I'm Elizabeth Ringgold. I'm 13. I'm a competitive dancer, and I'm in 8th grade.
I am Helen Mangold. I'm Elizabeth's mom. I have been in the medical field for many years. And I've been a dance mom for, 7 years now.
I had spinal surgery, and my doctor was Dr. Lentz.
After her first doctor we had, he kept canceling appointments on us. It had been a year. She started to really complain of back pain and that it was really hurting her. So I went through our insurance and went and did research and found him.
So basically, when we first got there, I wasn't so nervous. I was more happy because we were figuring out, what was going on, why I was in pain and everything. And then, we got an x-ray and everything, and, previous to, when he came in and told us about everything, I was asking my mom about, what happens, when you go under anesthesia, during a surgery. And then she was, explaining it, and then he came in, and he was like, well, the only thing that the only option is surgery. And I was like, oh, that's really funny, because I was just asking my mom about what happens when you get go under anesthesia. But I wasn't nervous when he told me about this. I had to get surgery. I was more just happy because I knew how to fix what was going on and what was causing the pain.
I had multiple emotions going with the process. But having my years of experience in ortho, I knew the best way to turn to is keep her involved with the process. And when we got the diagnosis, I knew it was bad, but I didn't think she was that bad. And the thing that stands out is when he came into the room, and after the x-ray, his first comment, he's like, I hate to discuss surgery right off the bat, but this is where we stand. And what really stands out is that, he told us that we could text him with any questions, call him, and he allowed her to answer and have any questions and voice her concerns through the whole entire process.
My name is Jon Lentz, and I'm a pediatric orthopedic surgeon, and I specialize in general pediatric orthopedics as well as spinal deformity. When I first met Elizabeth and her mom, she'd come in and she was a very active young dancer, very happy young girl, and very polite. We quickly realized she had a pretty bad deformity in her spine and a pretty big scoliosis. Unfortunately, she already required surgery, and I don't love talking about surgery the first time I meet somebody, but she really met the criteria right away, and we got the ball rolling pretty quickly to get her taken care of.
Well, before surgery, it wasn't really any different. I still did competitive dance and everything. I was still involved in, after-school activities. It was more just, I could do more with that, especially with, dance and everything.
Again, I had multiple emotions, 3/4 of which I tried to hold back and try to hide from her, only because I didn't want her to feel my nerves. I really voiced a lot of my concerns, and it was great working with the nurses I work with because I could talk to them, and if I had breakdown moments, I broke down. But understanding what she was going through and what came next was beneficial, because I was actually able to help her father and her siblings and everything to do what comes next.
In Elizabeth's case, she had a scoliosis that met the surgical criteria right from the start. When we talk about scoliosis in general, we look at how much growth someone has left and how big is their curve. In a 25 to 45 degree range, we could sometimes talk about bracing in a growing kid. Elizabeth was already over 50 degrees, which met the surgical criteria for a spinal fusion procedure.
So we went to the Jersey Shore Hospital, and I liked the nurses a lot, actually. Like, they came in and they were like really nice about the whole thing. Like, before like the surgery happened and after this, especially after the surgery. Physical therapy, it was rough for me because I didn't want to move at all. Like, I did not want to get up or anything. But especially with my mom, she helped to like push me to get up and like move around so I like could get out of the hospital and like I could like start recovering from home and I didn't have to stay in the hospital. But I'd say it was all like really good. Like, I liked everyone there.
So in order to correct Elizabeth's spinal deformity, we had to put some screws and some rods in, as you can see on the x-rays here. The first step of this procedure is to go in and remove some of the bone that's blocking the spine from coming back into a better position. And then we put screws in and these rods, which we contour appropriately to allow us to straighten the spine out. And we bring everything back to a nice straight position, as you can see in the post-operative x-ray compared with the pre-operative x-ray. So she did great with this surgery and we had a really nice correction for her. We were able to spare the entire bottom portion of her spine, even though she had a little curve. And this came back on its own, which typically happens with these, what we call compensatory curves, which aren't truly structural, but happen as a result of the curve above it. And especially in a young dancer, we wanted to preserve as many levels as we could without fusing to keep her mobility and allow her to go back to everything she wants to do in life.
I'd say I've done pretty well with the whole healing process. Like, I've gotten back to most of all the stuff that I've wanted to, even like acrobatics and tumbling. Like, even though I'm not really supposed to, but I still am able to. Like, it doesn't hurt at all. Like, I'll have some difficulty when it comes to like going backwards or like going forwards, but it's not like I'm like unable to. It's just I have to like accommodate to it.
Following surgery, Lizzie had this great support system in her parents, and they really helped push her to keep moving, get out of bed. And obviously after a big surgery like this, there's a good amount of pain following, especially the first few days. Every step of the way, I think she got up and was moving and trying to meet our goals in terms of walking around the floor, and we got her home at a reasonable amount of time, which is our goal, to get her home and in bed, sleeping comfortably and on the road to recovery as soon as possible. So when Elizabeth came in for her first follow-up appointment, she was walking with a little bit of help, but already doing really well. By the next appointment, at around 6 weeks, she was a different person, was already very close to back to normal. By about 3 months after surgery, I was having to put the brakes on her because she wanted to get back to dancing already. She was already trying stuff at home, had been up and moving, falling off the couch, being a kid again, which I love to see also. But she really just took off completely and recovered really well from the surgery. And she started showing me videos of her doing back bends and these incredible dance moves, holding her leg in the air. I couldn't believe what I was seeing after the surgery, but it was really cool to see, and now she's really clear to do everything and back to doing everything. I'm really happy that Lizzie and her family came to see us at Seaview Orthopaedics to meet our pediatric team and have her spinal deformity corrected. She's an excellent example of how to recover after a major surgery and really go back to everything she wanted to do in life. So we're happy she had a good result and look forward to a bright future for her.